Hey, I'm Dr. Travis Fisher, the founder of Genesis Chiropractic. And here at Genesis, we are focusing a lot on helping Singaporeans get through their pains and also some posture rehab. So come on in, let's take a quick tour of the area here. In this next section through here, we have an area that is specifically focused on spinal rehab. So besides the chiropractic adjustments, we're trying to train people on how to actually change their posture pattern and increase circulation to areas that might be weakened due to our daily lifestyle. So we have cervical neck traction, we have neuromuscular rehab with the wobble chairs. And then through here, we can go ahead and take a look at the treatment area where we do the chiropractic adjustments. Follow me. All right, so here we have Foz's case. Foz came in originally with neck, kind of shoulder aches and pains, a bit of a strain injury. And through the Genesis way, we have this process that actually helps to reintroduce the natural normal curves back into the spine. You can see the green curves is the ideal. It goes forward in the neck, it comes back in the middle, and then forward again in the low back. He starts out okay in the low back, but you can see his entire spine drifting back, and his neck is actually perfectly straight. This is a huge challenge because he automatically will start to qualify for certain procedures here. What we use is the Pedibond system, as well as parts of the CVP and the adjusting techniques with Gonstead, but the Pedibond system is geared towards introducing these curves back into the spine. If we don't do this, he will continue to have these muscle tightness reactions. It can actually trigger more nociceptors in the joints, which will trigger more pain responses. And also it can even create degeneration in the spine and disc compression. So the sooner we get him through this process, the faster he can be on the road to recovery and healing. So follow out here, let's take a look at how this system works. So part of the Genesis way is dealing with spinal rehab, okay? And when we adjust the spine, that helps set the alignment. These exercises help warm up the spine tissues so that it can help to align the spine easier, as well as hold the alignment as well. So part of this process here, he's on a bit of a wobble chair. And doing this exercise alone, according to research, can actually help to increase people's disc height, okay? We've seen this pre and post observation on the x-rays. So what we want to do is sort of arc the back, because we're trying to reduce this sort of posture that most of us are stuck in, head forward, rounding of the back, and we're trying to mirror that sort of posture to get more extension, okay? So we got an extension position, and in this position it's very simple. He's maintaining his proprioception balance, and he's going to move side to side in the hips. So side to side. We can actually increase the speed slightly here as well. And what this does is through the cerebrospinal fluids, it actually creates something called imbibition in the spine, which helps to pump fluids back and circulate fluids back into the disc spaces, okay? So we just do this for roughly about 3 to 5 minutes, and then the other motion is simply front to back, okay? Good. Now, certain people with scoliosis and these kinds of things, they might have to incorporate a certain type of bend in the process. And sometimes, in some cases, if someone has severe forward head posture, we might add some weights. This is part of the Pedibond system to counter mirror that action and pull the head back even further while they're doing the exercise. So essentially, we're trying to retrain the whole system into a new pattern, which will be highly beneficial for them over time. So following the warm-up, what we would do next typically is the actual chiropractic spinal adjustments. We use a technique variation here. We've used techniques such as Gonstead, diversified, drop table, motion palpation. And essentially, we would normally be using very specifically the x-rays, okay? Their posture pattern and the x-rays are very important in deciding where we want to locate and specifically adjust. We don't just guess here and lay people down on a table and start moving bones. We actually need to test and be very specific in this process. Knowing about Foz's case, he came in with the neck discomfort and the shoulder discomfort. Normally we would start with this area, and we're trying to gently warm up the tissues in order to get the spine to drop forward into the neck so we can reintroduce the curve. So we're just going to do a few drops into this area. Okay, just nice and gentle. Yep, that's it. Just do a couple more. Good. Okay, and then we analyze through the rest. We know where the misalignments are. Every time they come in, it pops up on my screen, so we know exactly where we're going to target. We know that his T4-5 area is really shifted to one side. So we're just going to do a very basic sort of drop in through here. Take a big breath in, let it out. There. Good. Okay. And we need to sort of retrain his rib alignment through here just a bit. Just let it relax. There it is. Good. We also discovered on the x-rays he has very specific kind of a hip imbalance. Okay. So we're going to go through this process here. All right. Take a deep breath in. Just let it out. This might look the same from side to side, but based on his x-rays, we need to do a different line of drives through here to set it into the right position. Just let it go. There it is. Good. Right in through here. Let's take a big breath in. Just let it out. There it is. And this is part of the neck adjustments. So this is an important part because we're trying to get that curve that's flattened to shift forward more. So we're going to move the bone up and through that direction here. That's it. Same here. There it is. Very good. And we're going to start to introduce this vibration adjustment. What it does is it stimulates the mechanoreceptors, which connects to the brain and helps us get better patterns back into the spine. Okay. We're simply going to help lift the chin. Good. Great. This one's a little bit longer. Very good. Okay. So the next step in this Genesis way is the cervical traction. This is very critical to help with the cervical curve. It actually even helps stretch down into the low back curve as well. One of the common things that often happens if somebody injures themselves or long-term chronic overuse, which creates misalignment in the spine, this kind of misalignment that we look for in chiropractic, what it does is it creates a lot of different problems. It can actually cause muscles to tighten. Called muscle splinting. It really kind of goes into a reactionary state. Unfortunately, that's really hard to change that pattern sometimes. On top of that, besides the aches and pains that may come with this, it affects many different things. It affects circulation into the disc. It actually even affects things like waste elimination in the joints and the cellular level. So what we want to try to do is open that up again. And this is a great tool to help in this process. So essentially how this works is Faz is going to go ahead and put this onto the neck, the lower part of the neck. He's going to step in closer to the wall and go under the chin here. So what's going to happen here is he's going to do some repetitive loading and unloading into the joints. And it really helps, besides the obvious things, kind of break up the discomfort in the area and some of the scar tissue. When the spine is out of place for long enough, it creates an avascular effect, meaning there's not a whole lot of circulation going into the disc. This can, again, stretch open the disc spaces and really reduce pressure on the spine. So he's just going to simply take a seat in a chair, pretend there's a chair underneath, and he's going to help to traction and load up the joints there. So what's happening, remember, he's got a straight neck, so it's going to help produce that stretch curve. This is one of the client favorites because the more they do it, the more they start to really relieve that pressure into the upper back and neck and shoulders area. And he holds it roughly for 10 seconds. And he goes ahead, stands up again to release and unload the joints, and then he's going to load the joints one more time. As people progress through the process, we might change the format. Maybe we do, instead of like 10 repetitions of 10 seconds, maybe we do 20 to 40 to even 60 repetitions of just a couple seconds. It helps to kind of create that pumping action into the disc spaces. So in addition to the Genesis way that we do in the office, there's a Genesis way at home as well. And this is the protocol of what's using the home care kit. So it's a spine orthotic along with a tailored program for exercises to do. We want to help people to not just get the adjustments here, but train and take some responsibility on your own at home. Okay? Just like when people brush their teeth to avoid cavities in the teeth, we're going to introduce some habits to get involved with avoiding so-called cavities of their spine. So it's, again, everything we do here is to help with the molding of the curves and open up the disc spaces, which will help reduce the tension and long-term effects on the spine. So a critical aspect of this process is the Posture Ray software. What this does is it allows us to digitize and measure precisely where the client's deviations are in their spine. This software shows exactly where they need to get the corrections in their spine, and it helps us to tailor their program best to their needs. So Foz, as we can see here, over here we have the ideal sort of spine measurement. Compared to your case, you can start to see where that upper body sways back. And this is critical for us to point out that this misalignment here in the neck is quite severe. It's actually perfectly straight. You can see how far away from the ideal that it is. We want to get this to shift forward as much as we can, okay? If we can do this, this will immediately start to reduce that stress into the disc spaces in the upper back, including the lower neck area that brought you here in the first place. If we take a look more closely, what we can see here, ideally we've got this beautiful, what we call the arc of life, okay? This shows open disc spaces. This is exactly what we're looking for. In your case, we can see that your spine is almost perfectly straight, and we can actually measure right now you're close to about a 10-degree curve, and this is based on where the C7 and C2 are. So because of these positionings, you're about a 73.6% loss of the normal curve, okay? So over time, we're going to focus a lot of energy into this area, and we want to help to shift that curve forward. We're going to adjust specifically C5, 6 to kind of help that pattern change. The sooner we can get this pattern to change, the better overall. If we take a look at the next section, and this is part of the process as well. We've got to measure, as you recall, on this last picture here, okay, we have the upper back shifting away from center. The neck is very straight through there. If we see the full picture here, right, deviation starts in the mid-back area. It's kind of straight and then kind of alters up through here. And that's going to create a lot of disc compression through the area. There's a lot of rib attachments in this area, so that can become a bit challenging to get changed through here. But if we set you up on specific protocols here, I think that's going to make a huge impact on this area. Again, going into the neck section here, you've completely lost this arc of life. See the red line compared to the green. This gives you an example of what that neck looks like. So this loss of the curve, okay, we can also start to see there is some calcification happening in the disc spaces, slight, subtle, okay. Obviously there's a lot to do to try to get a curve to be reformed into the spine, so it's going to be part of the process here. We can now target these spots with the traction and with the adjustments and all of these things. So hopefully this gives you some information, and you can see that by now our approach is geared towards measurable results. We want people to look better, we want people to feel better, and this is the Genesis way. We do this through helping your spinal issues. I'm Dr. Travis, and we look forward to helping you.